16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome to the brand new episode of KIMS Health Dr.Live. In each of the episodes, we bring to you an expert in the field of medicine to give you valuable information about good health. In this episode, we have with us Dr. Azam Al Abdullah, the Surgery Department, KIMS Health Hospital, Al Hazm. He is a laparoscopic surgeon specialized in the field of the surgery of thyroid, gallbladder, hemorrhoids, anal fissures and anal fistula. Welcome, doctor, to this new episode.
Hi, good evening everybody, and thank you for having me today.
Thank you, doctor. Doctor, can you please introduce yourself?
Yes, for sure. I'm Dr. Azam Al Abdullah, a general surgeon, currently working in KIMS Health Hospital in Al Bahrain with about 10 years experience in general surgery. Okay.
What are the surgeries you do in KIMS Health normally?
Actually, KIMS Health Hospital is considered a well-equipped hospital in Al Bahrain, and most important departments are available there, starting from emergency department 24 hours by 7. Also, we have good radiology departments with CT scan. We have nice and very good operating rooms, and we have ICU units.
Okay.
For that, we can do many cases, even emergency cases, emergency surgeries, or elective surgeries. I can talk about myself. In our surgical departments, we do many cases, example, thyroid surgeries, breast surgeries, abdominal surgeries, and laparoscopic surgeries for gallbladder removal, hernias repair, and appendectomy. And of course, we are doing proctology and many anal cases surgeries.
Doctor, can you explain what is proctology?
Actually, proctology is a branch of medicine or branch of general surgery dealing with the pelvic floor disease or pelvic floor disorders and rectal diseases, anal diseases, not only for surgical treatments, but also for non-surgical treatments. We can consider it subspecialty of general surgery.
What are the common anal diseases seen nowadays?
Yeah, the most common anal cases we can see in surgical department are anal fissures, hemorrhoids, anal fistulas, abscesses, and bilonidal sinus. This is the most common cases we can see in our practice.
What are anal fissures and what are the causes of anal fissures? Can you explain?
Basically, anal fissures is, we can say, it's small crack or small tear in the anus, which is very painful and annoying for patients. We are all know that the anus is very highly sensitive part of the body, and even small cut or small tear can cause and can result in severe pain. For that, usually patient coming complaining of severe pain during passing motion, and even after passing motion, patient feel there's deep burning sensation, maybe sometimes lasts for several hours. That's why it's very annoying and very painful disease. And because of this crack or this tear and the muscle around this region will be in spasm and also causing high pressure. And all these can cause problem for patient. And we can say that the mechanism of anal fissures, it's trauma to the anus. by severe stretching of anal canal.
Okay.
And there's many reasons can cause that, starting with passing large and hard stools, chronic constipation, also chronic diarrhea can cause anal fissures. But we have to mention that not always the anal fissure will be simple, because there is less common reasons can be related to another disease like inflammatory bowel disease, Crohn's disease, or also transmitted sexually in infections. That's why we need to be careful by taking good history from patient and to be careful by examination the patient.
Okay, doctor. What is treatment of anal fissure? Can you explain it?
Yeah, actually treatment depends on the fissure because we have two kinds of fissure. We have acute anal fissure and chronic anal fissures. Acute anal fissure usually is healed within 6 weeks. Chronic anal fissures last more than 6 weeks. And we have many options. And usually we going through the treatment step by step, starting with change lifestyle and food and diet modification. So always we encourage patients to increase taking good fibers and good amount of liquids and fruits, vegetables and waters and liquids. Plus we can using laxatives and stool softener, all of that just to keep stool soft. Also we can help patient by some topical creams just for pain relief. Also there's specific topical creams like diltiazem or nitroglycerin we can use. Why? Because these creams help patient to relax the muscle. Relaxation of muscle can increase the blood supply to that area and then help healing of the fissure and healing of that tear. This is the first option, and we can jump to another option, which it's small procedure we can do it, which is called Botox injection. Also, the same mechanism, Botox injection can do relaxation of the anal muscles. But if chronic fissures is resistant to this treatment, at that time we need to go for surgery.
Surgery is the last option.
Yeah, the surgery is the last option, and it's considered gold standard treatment. But I can mention that most cases of anal fissure can be treated and cured without surgery.
Oh, is it?
Yeah. This is good news. That's why I prefer to keep and to give patients option and to give patients chance to treat the anal fissure without surgery. Yeah.
what are hemorrhoids and what are the causes of hemorrhoids? Can you explain?
Yeah, hemorrhoids, simply it's swelling.
Swelling.
Swelling in the veins or anal or blood vessels located in the anal canal.
Okay.
Okay, this is simply the hemorrhoids. And we have internal hemorrhoids, which inside the anus, and we have external hemorrhoids.
Okay.
The external hemorrhoids located under the skin outside of the anus.
Okay.
Okay. And also the internal hemorrhoids, we have about 4 types or 4 degrees of hemorrhoids, of internal hemorrhoids, starting from first, second, third, and 4th degrees. And this classification is important for treatment plan in the future. Okay. Usually patient with hemorrhoids complaining of blood. He noticed there is blood on the stool after passing motion, okay, or in the toilet paper. Okay. Sometimes there's pain, sometimes patient feel there's lump or swelling in the anus, okay, or itching. This is the main complaint patient coming with hemorrhoids. The main causes of hemorrhoids also constipation, diarrhea, sitting for a long time in the toilet, if there's straining during passing motion, lifting heavy objects, pregnancy, also, and also family history, maybe family history, one reason. By examination, we can detect what the degree of hemorrhoids, and we do good plan for treatment.
Okay. Doctor, can you please explain about the anal fistula and the causes of the fistula?
Yeah. Basically, anal fistula, we have to mention that sometimes infection or abscess can happen in the anal region.
Yes.
Okay. And if these abscess didn't treat well and didn't heal well, it will develop anal fistula. Okay. What does that mean? That means the anal fistula is abnormal tract or abnormal canal with 2 openings, one opening inside, internal opening inside the anus, external opening in the skin around the anus. This is simply the anal fistula. And the main cause infection. I can mention, maybe this is a little bit complicated. In the anal canal, there's a small gland. Okay? There's number of small glands in the anal canal. And this is what make mucus just to make passing stool easily. Okay. These glands sometimes blocked. Okay. By stool particles. Okay. When blocked, it will get infected. Okay. And develop abscess. After that, develop fistula. This is simply the mechanism of fistula. And usually patient coming complaining of pimple or small swelling around the anus, okay, with in most cases with discharge. The discharge may be pus, maybe blood, okay. This is the main complaint. And sometimes there's pain or there's infection. This is the main complaint of anal fistula.
Okay, doctor. Can you please suggest some lifestyle changes to control these anal diseases?
Yeah, before that I need to mention that for all people and all patients who has anal disease or anal problem, please go early to check with your surgeon and with your doctor. Why? Because there's few cases will be not simple, okay, and there's few cases related to another disease. As we mentioned, like inflammatory bowel disease, Crohn's disease, and sometimes HIV. But for that, the good history taken from patient and good clinical examination is very important. Okay. For that, don't delay and go direct to check with your doctor. And not all for patient, for all people. Always we advise healthy diet. Okay. Avoid constipation. Always take good amount of fibers and liquids. Always keep the anus and anal region clean. Okay. Don't send for a long time, especially in toilet. Do exercise, walking, change your lifestyle to keep yourself healthy. Okay, and don't hesitate. I know this disease is little bit annoying and embarrassing for all patients,
true.
but please don't delay yourself because the treatment in early stage is much better than coming late.
Thank you, doctor. Thank you for being here in your busy schedule.
For any patient, you can meet me at KIMS Health Hospital and working there every day except Saturday. Every day except Saturday. I have morning shift from 9 to 1 and evening shift from 4:30 till 8:30. And you are welcome.
Thank you, doctor. We will meet in the next episode with a brand new topic and a new doctor. For the time being, I am Jasila Mujib signing off. Goodbye.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in